How can Primary Care Online help you and your practice team? Primary Care Online offers a variety of services including website management, care navigation for your patients, and even integration with clinical systems as well. In this series of videos, I'm going to show you everything you need to know about Primary Care Online. We're going to kick off by having a look at how they can help you with your website, the first part of your practice. Have you heard of Primary Care Online? Maybe you have, maybe you haven't, but they're one of the providers that we've had before on the channel, rebranded and got something interesting to show you in terms of how they can help you with your practice website, care navigation, and working with online consultations and so much more. Let's jump in as they help us tech enhance our primary care and learning. Hello, EGP learners. Welcome to this episode where I'm really happy to be joined by Steph from Primary Care Online. How are you doing there?
I'm good, thank you. How are you?
I'm good, thank you. So you're coming to talk to us about Primary Care Online. However, you have been on the channel before under different guise. Do you want to explain to people where you've been and what you've been up to?
Yeah, so my name's Steph, manager, owner and founder of Primary Care Online. So I'm an ex-practice manager and cluster or network lead. I worked in primary care for 17 years as a practice manager and network lead for our cluster of practices, but left just before COVID in good time to develop a patient-facing app because we didn't have an app in Wales like the NHS England had an app. We've evolved now as requested by our clients to offer a lot more services to include practice websites, online triage built into the website, care navigation tools, and clinical integration to clinical systems or 3 Vision, EMIS, and TPP System 1, and additionally partnered with strategic partners within the industry who have specialize in those fields of clinical integration, and also offer a lot more services now, such as text messaging and direct messaging to patients, and arrive and call. So we're trying to get everything under one banner. When I was a PM, I found it very difficult to manage multiple suppliers with different contracts and invoicing. So we're trying to streamline the workflow for managers, make life easier for them. So we've now got a whole suite of products as requested and with assistance from our clinicians and PMs developed to try and help primary care.
And you mentioned developing that based off feedback from your users and stuff, and that sounds amazing. For those that don't remember, you joined us from My Surgery app, which is basically what you've morphed from. That's correct, isn't it?
Yes. So the app was our first iteration of our product, which was really well received by patients. We still work with patient participation groups, 5 groups in the South Wales area, to get feedback from them as to what they want. Digital inclusion is really important, and not try and exclude patients. A lot of patients seem to think, well, there's only one way to access a service. Well, there's multiple ways to access a service, and digital services do not exclude patients from phoning or attending a surgery. But trying to make things easier for patients, we do have a digital training suite as well to assist patients who are not so tech savvy. So we've got a link with the Good Things Foundation where the patients can learn to use tech within primary care, i.e. how to use a touchscreen, how to use a mobile app. But we found that navigating a website became quite difficult for some patients with a lot of information out there. So we try to make that website navigation a lot easier, and then for primary care staff to link to from one source to multiple digital services offered to patients, so they can easily manage then all their digital services, not have 2 or 3 suppliers, just one supplier really for everything they need.
So what I'm hearing is basically trying to unify all the various different things that practices are having to use, not only because they want to, but because they need to, and at the same time making that easier for the practice to manage and run, hopefully moving forward.
Exactly, yeah. They're contracted to provide a lot of services under the GMS or the access standards in whatever country, home country they are. But we try, they don't have to do everything. So we try and help them through that process of opening up their digital front door, if you like, but choosing from all of our products or just a shopping basket so they can choose one or t'other. And and just it is a bit of a minefield out there for PMs, and they're busy enough as it is. So we try and manage that process for them and take all that work away from them, and try and make life a little bit easier.
Okay, so let's have a look at what you guys have been up to. I know we're starting off with the digital front door, which I guess is the practice website and stuff. So shall we have a look at that first?
Yeah.
Cool.
Okay. So we can share screen.
There we go.
Okay, so you can see we're in great. You can see we're in a test surgery now for one of our GP surgeries, which is Region Treat surgery, and this is all managed by the management portal. So when I was PM, I found it very difficult. I had a website provider, and I found it very difficult to update my own practice website because it was kind of WordPress based, and it's very difficult for PMs to update their own website. But we've got two packages really. So you can see now this is our practice website. And on our pricing page, we offer practices two options. There's a basic package where they get a full website and they can manage the content themselves from the portal we provide, and it's very easy to update your website. You can just add a news item, and if you can use Microsoft Word, this is a Microsoft-based system. You can update the website very easily with a title, text. We always date stamp everything, so it's really important with practice website that nothing is out of date. So you can put a date stamp on anything, and then just save, and that'll update your website. Or we offer a fully managed service where patients, some surgeries said, look, we don't have time to do this, so we update the website for them completely with unlimited update requests. So we do all the updates for them. But we try to structure our websites on the guidance from NHS England, formerly NHS Digital, where their website toolkit, we've scored maximum points on that. So we try and navigate patients as much as possible, easy as possible around the website. So you can see here now we've got our Region Street surgery, and for our practices in Wales, we do use Google or Bing Translate for multiple languages, but for Welsh practices, Google Translate is horrendous as a Welsh speaker myself, it's horrendous for Welsh translation. So we manually translate the Welsh. You can see here we've got English. We manually translate the Welsh. So when patients do go to a website and, for example, they click on a link here to download the NHS app, if they choose Cymraeg, it won't use Google Translate. It'll bypass that and will translate the correct Welsh translation. But for everybody else, then we go back to Google Translate. So let's go back to the homepage. So we put a video on here to try and inform patients that they don't have to just have to use what's on the homepage. They can also navigate the website by typing any keyword into here in the search bar on the homepage, and it'll search then for what we're looking for. So, for example, if I'm typing in smoking, it'll search the website and find all the resources in the website for smoking. And the video is also welcome to the patients, and it also tells them that we have the care navigation tool at the bottom right hand corner here, so they can help them navigate around the website also. So we've got static menus at the top. The new toolkit recommends that patients don't use a drop down. It's very hard to use drop downs when you go to mobile view, and the website is built with a mobile first design. So this is a kind of a navigation of the menu here. Any news items so we've got a news item here. You can see we've got a lot of news items there, but any news items which are really important in Wales, we've had it for a long time in England, but this is really important now to try and get patients to download the NHS Wales app. So this is an important news item which will sit on the homepage, and when you are putting a news item up, you can put it up, and if it's important, you can show that as a news flash. And instead of having a lot of websites will have rolling news events, which again are really hard for to view in a mobile. So we prefer to have them as static news items on the homepage, again with a date stamp for it to expire properly. Again, really important news items. The surgery. This is very Welsh-centric website. Bear that in mind. But we do cater for all home nations. But this surgery, they've got a new UTI. service available from a local pharmacy. There's a lot of information to read here. So we build AI videos also, so the patient can click on the video and explains the process. Again, there's no cost for this. We build the AI, we do all the building for the practices. The patient can click on the video, and everything that's down here, it's quite a lot of information for patients to read. It's all sort of put into this video so patients can just engage more with the service. Really, we find that these AI videos, particularly if patients have a very complicated appointment system, they can click the video. We'll upload the text that they would have on the page, and it's sort of a synopsis of what the surgery is trying to communicate to patients. Really, again, the AI videos are just you can choose your own care navigate, your own avatar, and your own sort of accent. But yeah, we upload that. So then we come to the home page, and these are the sort of big ticket items, if you like. We like to build a self-help hub on the home page, which sort of integrates or brings together everything that the surgery offers. So the self-help hub will bring together the check your symptoms, sexual health, again the self-referral hub. If you have a lot of self-referral pathways, this surgery, for example, has physiotherapy, Healthy Weight, Silver Cloud, which is an online mental health therapy service, Help Me Quit or Stop Smoking Wales, domestic abuse. All the self-referral pathways we like to put into one sort of hub, really. And then there's mental health crisis, AZ community services, education program for patients. There's a lot of that going on. So we like to just make this a hub for all the information that patients can find, really. And we'd like to put that on the home page so they can access it, and it's really front and center. Then we've got information about how to book a routine appointment or an urgent appointment. Admin queries, we can build any. We've got a form builder module within our management dashboard. We can build customizable forms, again bilingually, and we do all this for you. Patients can click on how to request a sick note, and they can fill out these really quickly. Is it for yourself, on behalf of the child, or somebody you care for? Patient puts their details in and fills the form out, and then submits. We'll go on in a bit to where that gets submitted to, but we can build any type of form for your surgery. We've got lots of templates which we built for other surgeries. You can use those as templates, but if you don't like that template, we can then edit that if you wanted to. And with any form, they can be populated to open on any day, or available from and to. So they automatically open at 8 o'clock and close at a certain time if you wanted them to open only within core hours, or to be, admin forms, you may want to keep those open all the time. To go back to the home page, when we do offer, for example, a form for an urgent appointment, it says here, before contacting us, please consider the self-help hub, and please consider emergency before contacting us. The patient this can auto open at 8 o'clock or 7:45, for example, whatever time you want the form to open. The patient fills out the form and then submits into urgent form. And again, we set all this up for you. But if you said, like, I want this to close daily at 9 o'clock, so only open for an hour, and for bank holidays, you can make it temporarily available, of course. We build it so that it doesn't just say we are closed for the day. And by the way, any message that's submitted, there's a success message that pops up to say that the patient's completed it successfully, and what is the next process for this form. It says our clinicians will now access your query and contact you with the appropriate program. You can edit that whatever way you want. But when the form does close, so let's save this now and go back and refresh this form. It now says that this form is closed as we've reached safe capacity. But instead of telling patients, please try again tomorrow, we try and inform patients, well, this may not be an urgent request. Please consider requesting a routine non-urgent appointment up to 2 weeks in advance. Or education, please click here. But also consider, in Wales, we have a common ailment scheme, which I believe is equivalent to Pharmacy First in England or Scotland. We give patients alternative care options. We're not just telling them, right, this form is now closed, please try again tomorrow, which they can. We try and divert the patient or educate them to say that there are other options available to you, like Pharmacy First or or Wales Eye Care service, whatever that service may be locally to you. When we build the website, we'll have a Teams call with the practice to find out exactly how they work, and then try and re-educate the patient as much as possible to what's available, and not just phone the GP for the first point of call. Again, we've got a link for order medication, and we link to whatever system the surgery is using. Again, this is Welsh-centric practice, so we're diverting patients now to the NHS Wales app to order, but we also tell the patients how else they can order medication. Again, we'll work with the practice to build that process. Again, in Wales, we have an urgent mental health support to get through to a trained mental health practitioner. So again, we try and promote that service as much as possible. 11%, I believe, of GP consultations relate to mental health. So really important to have that front and centre on the practice website. Again, under access guidelines or GMS, this surgery have a target of promoting unhealthy behaviours. So again, we worked with the practice to find out what the unhealthy behaviour targets are, and to try and promote that as much as possible. So maybe smoking, or lifestyle advice, weight management, drinking, alcohol and drugs. But we record hits on this. We can give that back to and the surgeries have access to the analytics, so they can record hits on this and again submit. We have health resource search what they're looking for, and we build this with your surgery. So, for example, this surgery has an ultimate list of mental health support. Again, the patient can click on this and then find support for whatever they're looking for, and that's searchable from here. Or again, once we've finished with the big ticket items, which we have images for these because we try and draw the user to that. But with accessibility guidelines, it's really not advisable to have images on everything. So for other things, we have quick links. So if you do have an online booking system, this surgery, they're based over two health boards. So they've got a few booking links. So they've got Llanelli, Carmarthen. We build a landing page so patients can say, okay, I'm in Swansea Bay, and then they can click the tile, and then that will take the patient to the online booking system for that locality, if it's offered, and they can go through then and book a blood test, and again choose a location. Okay, I'll select this one, and they can choose a date then when they can book a blood test. Let's go back. Or it's got a link to check your symptoms. Obviously this is Wales, so it'll go to the NHS 111 Wales self-assessment, where patients can check their symptoms there. And again, another link to the self-referral hub on the homepage, so they can self-refer then to physiotherapy. Click on the link, it'll take the patient through to the pathway to self-refer to physiotherapy, where they can fill a form out and self-refer if that is available. We then got other links, such as which the surgery may want to put up there, like my A&E Live or any clinics they hold. And then further down on the homepage, we've got links then for mental health and wellbeing, in addition to the emergency intervention, which is the 111 option 2. There are other mental health and wellbeing services which are maybe not emergency. We build interactive maps for these. So the patient can click on the mental health interactive map, and again, we'll work with the practice to find out what that is. And the patient can scroll over, okay, cruise or mind. Whatever they scroll over, they can click on it, and it'll take the patient then to that service offered by that mental health support provider. Really important to advertise that as much as possible. But again, we'll work with the practice or the network to find out what is available in their locality. It is individual to each practice, really. It can't be uniformed across the board. Other links then may be for sexual health and screening, family planning, information and help for carers. We worked with a cluster in South Wales, where they've got a really good carer service. We built a landing page for this service where we've got, again, AI generated videos with avatars and a local Welsh accent about information about a carer, about what the carers lead service offers in the practice and how they can register, latest news and events page, cost of living, and how they can tell the surgery they're a carer. So whatever the carer service offers, we can build landing pages again around that entire service. And And then we've got stuff like activity data. So again, practice have to upload their activity data. So they can send us screenshots every month, and we will update their activity data on a cumulative basis and produce our own infographic. We've got a member of staff employed who just does this every week for practices, and so patients can see then what the activity data is like for practices. So and again, community and voluntary services. So this is really important. So if you do link in with your network, when I was PM, I used to go to cluster meetings and try and get the third sector in as much as possible. So patients can find what's going on locally, not just in the surgery, but locally to them. We upload all this information, and maybe something like the Wellbeing service or Sanctuary, which is now developed support for people at risk of mental health crisis, or we link to Info Engine, which is a directory of third sector organisations across the UK where they can put the keyword in what they're looking for and then find that service there. So that's the home page. Again, we've got all the privacy and terms and conditions. We've got the accessibility tool built in, so patients can say, okay, well, please make the text dyslexia friendly, make it bigger. That tool is built in on desktop view and also mobile view. So that's the home page. Then we've got an events page. Really important. I really found it difficult to tell my patients when I was in practice if we had events on. We just used to put posters up and hope the patient could find the event. But we've built an event section. Again, we can, it's really easy. You can just build an event by going into here and putting an event on and following the prompts you've got. Or again, if you manage it yourself, or we can do all of this for you. And events are really good because it tells patients when the surgery is closed for staff training, and it tells the arrangements for when you are closed. Or if you've got community events such as a Dementia Action Week, it's this week actually, so we've put a Dementia Week up, next week, and it tells patients what's going on and where and how to access the service. And I think we've got an example here of a type 2 diabetes session, which is on Friday the 10th for this particular surgery. It tells patients what to expect, and there's a link there of how they can book in. Really important to have those events on, particularly when you do have flu clinics or COVID clinics or flu ends. You can tell the patients when they're on and how they can go about booking into those clinics. Again, we just got a synopsis of a news page of all the news items. And again, if going back to the homepage, if they're important, we'll put them as a static news item on the homepage. Again, a shortcut to the admin queries where patients can fill out the form for anything really. Information about the surgery. So if you want to put information about your main surgery, door opening times, if they do differ to your telephone opening times, information about your branch surgery, your staff teams, we can list all of these for you. Again, out of hours, there's an information page there dedicated to out of hours and how they can access MIU or eye care service or whatever it may be. And if you do want to advertise or inform your patients about the cluster or the network, we can put a network page up there for you to tell practices what you're doing as a network, what your priorities are, your cluster, your plans, and we've got a short sort of animated video. I think it's only 1 minute 30 long. Again, to try and inform patients by video, what the network is and what you hope to achieve. So that's the website. As I said, we've got 2 packages. There's no cost for the build. We'll work with the practice. We'll build it free of charge. We help them to retain their current URL and work with their own provider to retain that, or we can obtain a new NHS URL for them. But we'll cover all of that, so the practice don't have to deal with that. And 2 plans really, where they can have the website fully built for them. They only pay when it goes live. As I said, there's no cost for a build. The cheaper package is $450, and they can manage the website themselves from our portal. You can see it's pretty easy to build that. Or if they prefer, they don't have time, there's the premium package where we fully manage, and the surgeries can send us 1 or 1,000 update requests. We will do it all for them. If it's urgent, we'll do it within 4 hours. If it's non-urgent, it'll be done within 24 hours. So that's the website.
Awesome. Wow. And definitely that digital front door, as you mentioned, in terms of patients being able to access what the practice does and how it functions and stuff, and so much stuff in there. I definitely agree with the accessibility features, and I know that particularly for England as well, this is a contractually mandated process now. It's written into the GP contract, but increasingly it's also where additional resources come into play. So the CAPE funding, the Capacity and Access Improvement Plan funding, is also built in around having an accessible and usable website to integrate within the online consultations format and supporting patient digital access. So really applicable, not just obviously clearly Welsh focused there on a Welsh website, but absolutely for the rest of the UK as well. And that is how Primary Care Online can absolutely help you engage with your patients through your practice website. If you want to check out the video that shows you how to help with care navigation in the practice, check out this video. Alternatively, if you want to see their integration with Engage Consult, check out this video.